We see you as you sit behind the wheel of your truck. We see you shake out the nerves before you pick up your hammer, your scissors, your pots and pans. As you find new ways to keep the lights on and put the pieces back together, we see you. As you straighten the rows, keep your customers safe, and crunch the numbers, we see you. As you head back to work, we see you. You've got this. We're open to help you reopen. Visit bbb.org.
And welcome to this edition of the BBB webinar series, and we are so glad to have you with us today. We're focusing on ways to keep your business open and, most importantly, your customers and your employees safe in this time of COVID-19. And this is an ongoing series. So just a little bit of housekeeping for you. My name's Dale Dixon. I'm your host for the webinar. And we're going to spend the next few minutes diving into this topic. We're working to make it as interactive as possible. So we would ask that you use the Q&A box. We're using Zoom as our platform for the webinar. If you look at the bottom of the screen, you will see Q&A. If you'll hit that to ask a question, that's a fantastic way for you to interact with us, as this is a live webinar that we're recording today on the 16th day of July in 2020. And I give that date specifically because we have a lot of things changing rapidly, and some of the information that's provided today is based on what we know up to this point. But as you know, through this time, this challenging time, the information is changing and we're learning new things all the time. So within a week or 2 weeks, we could know something new. So just keep that in mind, and we appreciate your patience with us in that area and your grace and mercy, because we know that we have learned a lot over these last 3 months working together through this process of COVID-19 and the impact on our collective businesses. So today, as I said, we're working on keeping our employees and our customers safe. It is a top priority for any business that's working to build trust in the marketplace. And while the information related to COVID-19 is evolving, sometimes rapidly, today's webinar provides the latest known information and best practices. So our goal is to give you a set of resources and ideas that are going to help you be as successful as possible in the area of health and safety. Be sure and use that Q&A box that's at the bottom of your screen. This webinar is being recorded. You can play it back later. It will be made available to a wide audience later on. Today, this is live for BBB accredited businesses, businesses that have taken a pledge to uphold the set of standards, to do the right thing, because it's simply the right thing to do. And we thank you for being one of those accredited businesses and building trust in the marketplace with us. Today, we are fortunate to have Adam Gerson with us. He's a compliance assistance specialist with OSHA, the Occupational Safety Health Administration. And as the Occupational Safety and Health Manager, he's an industrial hygienist and safety compliance officer with more than 30 years of experience. His background includes conducting process safety management inspections and accident investigations on large-scale manufacturing and multi-employer construction sites. He served as a construction coordinator, federal agency program officer, and record-keeping liaison for the Pacific Northwest region, and on multiple safety committees in the state of Idaho. So Adam, it's so good to have you with us. I'm going to let our audience know that in the moments leading up to the webinar, we were starting to see some bandwidth issues with Adam's internet connection. It usually will happen like that. And so Adam has his camera shut off so that we devote as much bandwidth as possible to his audio. Adam, with that, I will say hello and welcome to the webinar. Thank you so much. We're going to pull up your presentation so the folks at home can see it. And with that, I will let you take it from here.
Thank you very much, Dale, for that introduction, and thank you to everybody who's listening in on the webcast today. Today I'm going to be going over a COVID-19 presentation that OSHA is distributing, and it's designed to provide a brief overview of the topic and to provide some guidance into some of our standards that might come into play with regards to COVID-19, and then also go over some of the OSHA guidance that's available on the internet, on our website, for you to make yourselves available to. Change. So just note that for the time slot, I decreased the size of the presentation by about 10 slides. So if you would like to have a copy of the entire 35-slide presentation, my email address is towards the tail end of the slide deck, and you just have to contact us and we'd be happy to forward it to you. Otherwise, this is just our template disclaimer for our slide deck presentations. Change. Okay, so to begin, what is the novel coronavirus? Coronaviruses are a family of viruses that can cause illness in people. Coronaviruses circulate among animals, including camels, cattle, and cats. SARS-CoV-2, the seventh known human coronavirus, and the virus that causes COVID-19 is thought to have jumped species from animals to begin infecting humans. Change. So how is COVID-19 different from other known coronaviruses? Well, several coronaviruses cause common colds, but are not significant threats for most healthy people. Other coronaviruses have caused past outbreaks, including SARS or severe acute respiratory syndrome, and MERS or Middle East respiratory syndrome. Each of those is caused by a different coronavirus. SARS-CoV-2 is a distinct coronavirus. And one thing I would like to say on these slides is that you'll see our website, osha.gov/coronavirus. That's where you can obtain the most up-to-date information that we've published on COVID-19 and our related guidance and related hazard assessments. As far as the sign and symptoms of infection, COVID-19 typically causes mild respiratory illness, but can cause severe disease, including pneumonia-like illness. Typical symptoms include fever, cough, and shortness of breath. Symptoms begin from 2 to 14 days after exposure. Change. As far as the current pandemic goes, there's more than 10 million cases worldwide. Different parts of the United States are seeing different levels of COVID-19 activity. All 50 states in the United States have reported cases of COVID-19 to the CDC or the Centers for Disease Control and Prevention. Change. US COVID-19 cases include imported cases from travelers, cases among close contacts of a known case, community-acquired cases where the source of the infection is unknown, and most US states are reporting community spread of COVID-19. Change. How COVID-19 is spread? Well, it's spread from person to person. COVID-19 is thought to spread mainly through close contact from person to person in respiratory droplets from someone who is infected. People who are infected often, but not always, have symptoms of illness. People without symptoms are able to spread the virus. There's also spread from contact with contaminated surfaces or objects. Change. If you have been exposed or infected, prior to seeking treatment, alert your healthcare provider or occupational health clinic if you think you may have COVID-19. You should tell your healthcare provider if you've been exposed to someone with the virus and have signs and symptoms of infection, as well as about any recent travel to areas where COVID-19 is spreading. Change. As far as diagnosis and treatment, your healthcare provider can determine if you should be tested for COVID-19. There's currently no vaccine for COVID-19. Some patients, especially those who become very ill, may require supportive care in a hospital. Change. As far as the occupational exposure risks, OSHA is closely coordinating with the CDC, including NIOSH, and other agencies to monitor the ongoing pandemic. The risk of exposure in many workplaces likely reflects the risk to the general public in the community where the workplace is located. The risk increases when workers have frequent, close contact with the general public or other coworkers. Change. Workers in some sectors may have increased risk of occupational exposure to SARS-CoV-2. This includes healthcare and laboratories, emergency response, mortuary services and other death care, airline operations, border protection and passenger screening, and critical retail operations such as grocery stores and pharmacies. Change. Workers in other sectors, including some in critical infrastructure, may be at risk because of frequent or long duration contact with coworkers. This includes food processing, including meatpacking, manufacturing, construction, oil and gas, and other sectors where workers would typically be within 6 feet of one another. Change. There are existing OSHA standards to protect workers from exposure, and you should follow existing OSHA standards to help protect workers from exposure to SARS-CoV-2 and infection with COVID-19. Employers should also remember that OSHA can use the General Duty Clause or Section 5A1 of the Occupational Safety and Health Act to ensure that workers are protected from recognized safety and health hazards that may cause serious harm. Some of the relevant OSHA standards that can come into play are our personal protective equipment subpart I, which has to do with PPE, general requirements, eye and face protection, respiratory protection, and hand protection. Other standards that may come into play include the bloodborne pathogen standard, the hazard communication standard, and our record keeping standard. Change, please. As far as OSHA enforcement goes, OSHA typically responds to emergencies, including disease outbreaks, in a technical assistance posture. We provide compliance assistance to employers to help ensure workers are protected. We provide technical assistance and support to other federal agencies as well as state and local partners. And we have implemented an interim enforcement plan for investigating COVID complaints while ensuring the safety of workers, employers, and inspectors. Change. OSHA has provided enforcement discretion for some of its requirements, including the respiratory protection standard, other health standards with respirator requirements, and recording and reporting occupational injuries and illnesses. On the right part of the slide, you can see a list of some of our documents or enforcement discretion that we've published on our website, osha.gov/coronavirus. This includes aspects with regards to how we do enforcement guidance for respirators in light of the N95 shortage, enforcement for respiratory protection when other types of respirators are being used from other jurisdictions, expanded guidance on respiratory protection with regards to N95 filtering face pieces during the pandemic, and also enforcement guidance for recording of cases with regards to coronavirus disease. Note that all of these guidance documents are available on the OSHA website in the coronavirus topic page. Change. So OSHA has developed a variety of guidance materials for workers and employers on how to stay healthy during the pandemic. Again, the website, osha.gov/coronavirus, includes information on implementing the hierarchy of controls when workers have specific exposure risks. Change. Some of the OSHA guidance that we published on our website include OSHA alerts or guidance for the construction workforce, for the manufacturing workforce, for package delivery workforce, for retail workers, and then also general guidance on how to prevent worker exposure to coronavirus. Change. This is general OSHA guidance with regards to recording or record keeping of exposures to COVID-19. Note, I'm going to go through this slide, but there has been additional guidance that's been published with regards to our discretion with regards to how to do enforcement specific to recording of cases relative to COVID-19. COVID-19 can be a recordable illness if a worker is infected as a result of their work-related duties. However, employers are responsible for recording cases related to COVID-19 if all of the following are met. Number one, the case has to be a confirmed case of COVID-19 per CDC-related information or guidance. The case is work-related as defined by 1904.5, which is part of our record-keeping standard. And the case involves one or more of the general recording criteria set forth in our record-keeping standard 1904.7, which includes a case that involves medical treatment beyond first aid, days away from work, or in the worst case, a worker fatality. OSHA is providing enforcement discretion around record-keeping for most sectors. And you should visit OSHA's Injury and Illness Record-Keeping and Reporting Requirements page for more information. Change. With regards to worker rights, all workers have the right to raise a safety and health concern with their employer or request personal protective equipment, report a work-related injury or illness, including COVID-19, and they have the right to receive information and training on job hazards in their workplace. Change. As far as their whistleblower protections under the OSH Act or the Occupational Safety and Health Act, employers cannot retaliate or fire, lay off, demote against workers for engaging in activity that's protected under the OSH Act. Protective activity includes requesting personal protective equipment, wearing personal protective equipment, reporting a work-related injury or illness, including COVID-19, reporting an unsafe condition to an employer or OSHA, or requesting guidance on workplace safety from an employer, OSHA, or other government entity. Change. As far as work refusals under the OSH Act, employers have the right to refuse to perform work if they have a reasonable apprehension of serious injury or death resulting from the hazardous condition of at the workplace, if they refuse in good faith to expose themselves to the hazardous condition, if they have no reasonable alternative, and if they have insufficient time due to the urgency of the situation to eliminate the danger or to resort to regular statutory enforcement channels such as OSHA or contacting the OSHA state plans. And where possible, they sought from their employer and were unable to obtain a correction of the dangerous condition. Change. So for continual updates on COVID-19 related topics as it relates to OSHA, the website is the best source of, or the most up-to-date information with regards to that particular topic. We're still publishing information even in July. And you can also obtain information through our Quick Takes biweekly newsletter, through the OSHA tip of the day. And you can also look at osha.gov/contact us. And we have social media pages, including our Twitter handle, and then also our Facebook page. Change. So this is my contact information if you were looking to obtain the entire slide deck. Again, it was a 35-slide presentation. I'd be happy to forward it to your way. And also the OSHA Directorate for Support and Emergency Management, their contact information is listed here as well. So aside from the presentation today, what was distributed to everyone was a handout that goes over a variety of different resources that are available to you on the internet that was created after this presentation. And I just wanted to provide it to you just so you could have updated information with regards to COVID-19 and related resources. You could see that there are a variety of different organizations that are tapped into here for information, including the CDC and NIOSH, and also state plan references are included in this handout. I'm just going to reference one particular link that's on this guidance, and that's 10 steps all workplaces can take to prevent exposure or reduce the risk of exposure to the coronavirus. It's actually a poster that's available on our website in 10 different languages. I won't read the whole poster to you, but it goes over basic aspects that all workplaces can take to reduce the risk of exposure to coronavirus, including encourage workers to stay home if they're sick, encouraging respiratory etiquette, using alcohol-based hand rubs that are at least 60% alcohol, and also this telecommuting is on here too. So again, this is something that's available to you, and it's in 10 different languages on our website. Also, what's available on OSHA.gov, if we can go to that quickly, if we go to that webpage, is on the right-hand side are various highlights of documents that have been recently published, including guidance on returning to work, and then OSHA alerts for particular industries, including nursing homes, dental practitioners, restaurants, construction and manufacturing. And then in the middle of the page, you can see there's a frequently asked questions link that was just uploaded on July 2nd. This FAQ page has information on, or questions dealing with cleaning and disinfection, face coverings, testing for COVID-19, and training. And like one sample question that's listed here includes what type of COVID-19 training resources are available for employers. So I would encourage you to delve into this if you would like to obtain more information about commonly researched topics. So that's basically my presentation for today. From here, we're going to open it up to Q&A. If it's something that I'm not sure of the answer to right now, what we'd like to do is get back to you in the future. We have, apparently we have people's emails, and we'd be happy to respond down the line. So thank you.
I always do that. It would help if I unmute myself. Thank you, Adam, very much for that. Our first question comes from Jennifer, and she asks if there is guidance to AC, I'm guessing HVAC, air conditioning, and guidelines to any standard levels of maintenance. So I'm assuming that this deals with air circulation inside of spaces and the impact of that. So any guidance?
For that particular question, I think I would like to get back to the questioner on, if you're dealing with, if she's responding to or asking about circulation in a building. So we'd like to definitely get back to that particular questioner on that one.
Okay. Yeah, guidelines and standard levels of maintenance for air conditioning. Let's see. Greg is asking a question, and on the N95 mask, Greg writes that he was on a webinar by a PPE specialist who also works with OSHA. Their stance was the N95 mask is not intended to be used the way it's being counseled, and in fact causing headaches, dizziness, and sluggishness. Is OSHA pushing compliance, knowing that the specialist states otherwise? If so, how does OSHA expect people to handle other causes of overwearing an N95 mask? So I think this might get to conflicting information about masks that is out there.
Yeah, and thank you for the question, Gregory. I would just say that our requirements are still in play with regards to the respiratory standard and our and respirators that are required as part of that standard. I will point them to the FAQ section that deals with respirators, surgical masks, and also face coverings. And then also that N95s are, if it's still required in a workplace to be used for respiratory protection, we would still concur with that assessment.
Two questions related to reporting. Kristen writes, we are following the CDC guidelines and protocols concerning safety for our employees and patients. However, if an employee tests positive for COVID-19, are we to report this to OSHA? Also, how do we know where they contracted it? And is the employer liable on some level?
Okay, so for with regards to COVID-19 and whether or not to record a case, OSHA has, as I mentioned during the presentation, developed enforcement guidance with regards to how employers are supposed to determine whether or not a COVID-19 case is something that is recordable and work-related. And as far as whether or not a case needs to be reported to OSHA, if any workplace has a worker fatality, that does have to be reported to us within 8 hours. And then also, if someone has a inpatient hospitalization related to a workplace-related case, that has to be reported to us within 24 hours. And that's not something that is particular to COVID-19. That's just our general reporting requirement with regards to a worker fatality.
Adam's audio is breaking up a little bit. The next question deals with the need to record a COVID case for OSHA if it was not employer related. Janine asked that question. Do you need to record a COVID case for OSHA if it was not employer related?
Again, I would, and Dale, how is my audio? Can you hear me okay?
You're coming through okay now, yes. Yep.
Okay, excellent. So what I would point Janine to is the OSHA guidance specific to record keeping that I just mentioned with regards to recording COVID-19 cases, and that she should make a determination as to whether or not that COVID case happens to be work-related or not. If it's not a work-related case, then it's not something that would normally be reported to OSHA. But I would just caution them to follow the OSHA guidance that's been developed and to make themselves available to that, which is posted on osha.gov/coronavirus.
Okay. Mary asked the question, are there guidelines for employers when employees return from time off and they've been to an area of the country that is not practicing safety protocols, face masks, social distancing?
This question might be related to more along the lines of state and local guidelines, and then also guidance that's placed out by the CDC. So I would reference them to state and local related guidelines, and then also guidance that's been distributed with regards to the CDC regarding travel and possible 14-day quarantine, et cetera. But that's not something that I believe is distributed by OSHA. We could follow up on that question and make sure that I'm answering that correctly.
Perfect. And that's a great note for all of our webcast participants, that we're going to be getting all these questions to you to follow up on if there is any additional information that OSHA has to respond with that. So with that, Adam, we've two more that just came in. Debbie writes, if an employee contracts COVID at work, does the employer need to pay for testing or for other employees?
So for that particular question, I would point them to a guidance document that OSHA has published with regards to determining whether or not payment is required for COVID-19 testing. It's called the Guidance on Returning to Work. And actually in the guidance document, it has particular FAQs that deal with payment of COVID-19 testing. So I would refer them to that particular document, and that's available on the website. If you're on the COVID-19 page, I would go towards the top right-hand side of the page. It's one of the top links in the highlighted links.
All right. We have Sonia asking if we can put your contact information back up on the screen. So I'm going to do that as I'm bouncing between screens. I'll just ask folks to bear with me as I look for the right screen to share. So there's Adam's contact information again. And then Marty is asking, where is OSHA's information about masks? And I condensed that question down, but if we go back to OSHA.gov.
So that's a great question. Okay, so a good place to find information about masks is to go to that FAQ document that I referenced that was published on July 2nd, or the frequently asked questions. If we go to the website, we could show people
all right,
where to find that.
Well, once again, I'm going to ask folks just to bear with me as I bounce through a variety of screens. Okay.
All right, towards go scroll back up a little bit, and then you see where it says frequently asked questions under news and updates. It's the last link there. So scroll down a little bit.
Scroll down.
All right there. So frequently asked questions under news and updates all the way down. The last.
Oh, right here. Thank you so much.
There you go.
So we're at, just so folks at home can see, we're at OSHA.gov, and we're looking at this frequently asked questions, center lower third of screen.
So if you click on
just
that
clicked on that.
And then in the link here, look for cloth face coverings, which is the third hyperlink. If you click on that, and you can see there's a variety of different questions that deal with face coverings, including the differences between masks, face coverings, and respirators. And then even the third question here is, should workers wear cloth face covering at work in accordance with the CDC recommendation for all people to do so when in public? So I would encourage people that if they're interested in face coverings and related guidance, to avail themselves of this FAQ document and to take a look at this section dealing with face coverings.
Okay. So I think that covers it so far for the questions that have been asked. Caroline writes, I had a conversation with an OSHA representative. I have employees that, although do not have a medical exemption, feel that wearing a mask is a detriment to their health. What is the response that we should talk with employees with this concern? What is your response that we should talk with employees with this concern?
I think we'd be happy to follow up with this questioner offline.
Okay. We will get that information to you. And I'm going to one more time put Adam's contact information up on the screen for folks. And that is all of the questions that we have at this point. So Adam, once again, thank you so much for your time today. We appreciate it. We appreciate our folks who have joined us for this webinar and this information. We'll just go ahead and point folks back to the ever-increasing body of information that we have available through a variety of websites, OSHA.gov included in that. And then there's always the Better Business Bureau website as well, where we're making information available. One question from April just popped up. What is guidance on call center work environments and the use of plexiglass dividers between cubicles?
Yeah, so would go to, can you go back to our website again? Like the main cover page.
Okay.
And then scan down. And if memory serves, I don't think we have specific guidance that's out there for call centers, but we do have a section that deals with hazard recognition. And so for call centers, I would we scroll past it a little bit, go back up a little bit, a little more.
Hazard recognition. Okay.
Right there. Okay. So I would hazard recognition. So I would advise the person that's listening in to go to the hazard recognition section. And there's one link here identifying potential sources of exposure. And OSHA in the hazard recognition page identifies particular work sites as their relative level of risk. Like the highest level of risk would be an aerosol generating activity that you might find in healthcare, to high risk and medium risk. And I would advise them to look through this hazard recognition section and then identify their particular work site and see how they fit into our particular guidance. On this one, though, I would be happy to follow up with them further by providing additional information.
Okay. And I'm going to let Caroline know that Adam will be in touch with you via email to dive into some of these questions that Caroline is using the Q&A section for. So we're not ignoring anybody here, but it looks like this is a conversation that needs some clarity offline. So that will be taking place, and we'll be sure to get Caroline's information to Adam to follow up. So with that, thank you so much, Adam. We're about 5 minutes past time for this webinar, and we definitely appreciate it. We appreciate everybody's time with us, and we'll be back next week with another webinar on how to make your business better in light of COVID-19 and the struggles and the challenges that we're facing as a business community. We thank you again, Adam, for being with us. And with that, we're going to sign off, and we wish you a great rest